Hi everyone, good evening. So let's wait for some more time, 2, 3 more minutes, not five, but 2, 3 more minutes. People are joining. We got a lot of registrations and people are joining. They take 1 or 2 more minutes. So let's wait for 1 or 2 more minutes. We'll start in 2 minutes, guys. Okay. Hi guys. So let's start. Let's not wait much. So I welcome you again today's webinar. This is very fantastic webinar again, and you guys, as you know, we have a very fantastic person with us to deliver today's webinar, and this is going to be one of the wonderful, I believe, because he's going to talk his journey, how he entered into the nodal officer, and then now he's working at AIIMS Jodhpur as research associate 3, one of the very reputed post in the clinical research, and he's getting after PhD. Sorry, he's getting after the PharmD. So this is very, very, proud thing for all of us. And guys, I welcome him. So let me introduce him. Hi, Dr. Hitendra. How are you?
Hi, sir.
I just
Very
came to
good
know
evening.
that you are from BNP. I know many people, your principal and Dr. Kamal Singh Rathore and Dr.
Yes. I've graduated my B Pharm. I've done my B Pharmacy from BNIPS.
Okay. Then PharmD from?
From Pune College of Pharmacy.
DY Patil. Yes, absolutely.
No, not DY Patil. Bharati Vidyapit.
Bharati Vidyapeeth.
Yeah,
Okay.
yeah.
Pune College of Pharmacy.
Yes, sir.
Okay, great. Wonderful, man. Wonderful. Amazing guy. Okay, so guys, let me take this privilege to introduce my young fellow. So he will be talking about his journey and he will be discussing a lot of things with you. Please try to learn from him. And at the end of this webinar, you will get a feedback link. As always, we have this tradition. And based on that, you will get your certificate. So let me take this privilege to introduce Dr. Hitendrapal Solanki. So he has done his Bachelor of Pharmacy from BNP Udaipur, and then he did his PharmD post baccalaureate from Bharati Vidyapit, Pune College of Pharmacy, Pune. Uh, okay, so can we put? Okay, no problem, guys. Please put off your mics if you are not speaking. Yes, so he did his PharmD from Bharati Vidyapit, Pune College of Pharmacy, Pune, and he has a wonderful professional experience. First, he started as a clinical pharmacist intern at Bharati Hospital and Research Center, and then he worked at Dr. L.H. Hiranandani Hospital. Then he worked as assistant nodal officer and pharmacy lead for antimicrobial stewardship in GMCH. Gitanjali Institute of Pharmacy, Gitanjali University, and then right now he's working at as research associate 3, All India Institute of Medical Science, Jodhpur, AIIMS Jodhpur, right, guys? So you will be getting a lot of learnings from him today, and he'll be talking about his journey and how another families can go into that. And he has published many papers, done many projects, and right now he's working on the one of the wonderful topic of antimicrobial stewardship, guys, with AIMS Jodhpur. So over to you. I'll not take much time, Dr. Hitendrapal. So over to you. Please go ahead. Yes.
Thank you very much, sir. It's my honor to be over here today. So, hello everyone, and good evening. So, today let me start with the antimicrobial stewardship. I hope over here everyone must be aware with what is antimicrobial stewardship, right? So, today, I'll not waste my time by because sir has already introduced me, and let me just recorrect one thing that I had been working also as an assistant professor in Gitanjali Institute of Pharmacy. Right now, many of the participants must be knowing me before this session only because they had been students also from Gitanjali Institute of Pharmacy. So hello to everyone, and wait. I'll share my presentation. Yeah. So is it visible?
Yes, you can share, Dr. Hitendrapal. Yes.
Yeah. Okay. So, what today we'll go with that is firstly overview of antimicrobial stewardship. Firstly, what the stewardship is. Stewardship itself tell us that we are taking care of something. We are taking care of some some medicine. We are taking over here. We are. It is clearly mentioned that we are taking care of the antimicrobial. Okay. So what lead firstly, we'll go with what leads to development of antimicrobial stewardship. Everyone knows that nowadays in today's generation, there is a huge urge in antimicrobial resistance. So antimicrobial stewardship is the global action which plans on the antimicrobial resistance. Okay, to optimize the use of antimicrobial medicines in human as well as in the animal health. Everyone knows that the irrational use of antibiotics is not only in the humans, but these are also being used in animal health as well. Veterinary doctors are also prescribing antibiotics that which the animals must be not requiring, and else something like that way to improve the patient outcomes, reduce AMR and healthcare associated infection. Okay, so healthcare associated infections is the thing which is most likely to get the patient infected with that. So that we have to reduce, we have to make the very much well uses of the antibiotics so that in future, not now, in future also we can take good care of our patients and other say healthcare across the amongst others as well as it might be sometimes it might be from amongst us, amongst any of the healthcare worker itself, anyone can get infected. Okay, so we have to take care of the use of antibiotics. What leads to the development of AMR is that overuse and misuse of the antibiotics is the most common, that is the key driver, I would say, that is the key driver to for the development of antimicrobial stewardship. Okay, nowadays what happening is the WHO has carried out a classification, that is an AWARE classification, uh, according to the WHO essential medicine list. So why this AWARE classification was made out? Because what WHO thinks that the selection of the antibiotics and the use of antibiotics, use of essential medicines list from which has been made by the WHO for monitoring the antibiotic consumptions, defining target associated drug therapy, target associated antibiotic therapy, and to defining and monitor the effects of the stewardship. The main aim of this AWARE classification is to curb the antimicrobial resistance. Okay, so these are some of the drugs which are included in the AWARE classification, like A stands for the access group, WA stands for the watch group, and RE stands for the reserve group. These are some of the antibiotics which carried out into this classification in this manner. Okay, so next point which we are going to cover is what is the aim or goals of the AMS. I hope everyone might be knowing that what are the goals of AMSP, what are the goal of antimicrobial stewardship. Okay, so just to optimize the use of antibiotics, promote behavioral changes in prescribing pattern and in the dispensing pattern as well. We know that we all are very much aware that many of the retail pharmacy store, what they do, some patients in generally they used to go to the medicine, they go with the complaint of the, yeah, like I am going to any pharmacy and I am telling that pharmacy, भाई थोड़ा सा सर्दी हुआ है, हेडेक है, और irritation in the neck, irritation गले में irritation हो रहा है, what that pharmacy will dispense, they'll straightforwardly they will dispense with the azithromycin and with some of the antihistamines like cetirizine and all. So over here we can say that we have to make aware not only the prescriber, we have to make aware with the dispensing authority also. We have to go and we have to make them aware that there is no need of the antibiotic in such complaints like the majorly we can say that as the URTI. Okay, there is minimal use of the antibiotics in URTI. So next, to improve the quality of care and the patient outcome, save an unnecessary healthcare cost, because antibiotic is so costly that not everyone can afford in the daily life. So we have to take care of the healthcare associated care cost to reduce further emergence and spread of antimicrobial stewardship. These were all the goals of the antimicrobial stewardship. Okay, antimicrobial prescribing facts. There is a study which has been carried out in ICMR that shows the fact that 30% of patients hospitalized receives antibiotics, which might be there is no the patient might be not needing those antibiotics. So this was the one result over there. About 50% of antimicrobials used have been found to be inappropriate. Okay, so you can see over here that this is a huge number in which antibiotics has been used inappropriately. So the basically antimicrobial stewardship is carried out just because to reduce those numbers, reduce those irrational use of antibiotics, inappropriate use of antibiotics, to reduce the cost of antibiotics, that will ultimately lead to the healthcare, that will ultimately what will happen, that healthcare cost will also go in a down search, because the major costing, if you will see the bill of the patient while the discharge, then what happens over there, if the patient is infected with some of the bacteria, then Like I'll give an example, basic and very common antibiotic, that is meropenem. A single vial of meropenem cost something nearby 4,000, and that a patient requires it in a TDS dose. Okay, so and that too for the duration of minimum 5 days. Okay, so if we'll calculate it, it will, the bill of that patient will go on a huge, no, huge amount. So to just to reduce the bill, to reduce the irrational use of the antibiotics, to prevent the to prevent more and more antimicrobial resistance, we have to take care of the antibiotics. We have to go with a good antimicrobial stewardship. Okay, so now next one is future aspects and how to reach over there. Okay, so basically anyone can reach, anyone can go with the antimicrobial stewardship and in hospitals. Okay, so every families are supposed to do their are because of their curriculum activity, they are supposed to go for their internship. In between their 6 months of general medicine internship, everyone can do their antimicrobial stewardship. Those hospitals are affiliated with NABH. They are into this stewardship. So everyone can go into that, and they can start with antimicrobial stewardship during their internship only. Because antimicrobial stewardship now only it is, there are so much resistance in the bacteria for the antimicrobials, that we can't even think what will happen in the future. How to tackle those bacteria, how to tackle those gram negative bacteria, how to prevent patients from those uh, nosocomial bacteria. Okay, those are killing the keep killing the human beings. I have seen over here that many of the patients, while I'll just take two of the examples, two of the deadly bacteria. Okay, so that has been emerged nowadays. That is one of these Acinetobacter, and the second one is DTR Pseudomonas. I hope someone of you might have heard about these two bacteria. There are but no single antimicrobials, no single antibiotics are being susceptible to these bacteria. Okay, so how do you think how we are going to treat this scenario is of just today's scenario? What we'll do in future? So we have to go for the antimicrobial stewardship. It is a very good and emerging topic nowadays. Okay, so I hope everyone will now be well aware with the what is antimicrobial stewardship, and how you can reach over there is just to go with the internship. Start doing your antimicrobial stewardship. Start studying antibiotics. Okay, just not with the theoretical part, and also to look at the patient clinically, because many a times what happens, the theoretical part of the antibiotics is not sufficient to start with the empirical antibiotics. Okay, we have to look out at the patient clinically also. Many a time there are normal lab reports are the normal, but the patient is in septic sepsis. So we have to look into it. We have to rule out the reason of the we have to rule out the reason of the infection. We have to many of the things are there to look out into. So by that also we can go for the correct choice of the empirical antibiotics, and that we have to tell the prescriber, tell the consultant that to start to go for the culture reports. After that, the culture reports will, as soon as the bacteria has been incubated, so after that the susceptibility report, what we have tell is the Vitek report or else AST for that particular bacteria. According to that, we have to change the antibiotics, we have to change the antimicrobial therapy for that particular patient as soon as possible. Okay, this is what generally antimicrobial stewardship antimicrobial steward do, and what antimicrobial stewardship is. This is a well classification, and this is as well as this is also antimicrobial stewardship goals. Goals are to limit antimicrobial resistance, to decrease adverse antibiotic events, to reduce healthcare costs, to decrease C. difficile infection, to educate healthcare workers, to increase adherence to guidelines, to improve patient outcome, to reduce inappropriate antibiotics use. Okay, so here there is a goal which is to decrease the C. difficile infection. Many times what happens, the overuse of antibiotics that itself leads to the C. difficile infection. Okay, so we have to prevent this infection also. But this infection will be prevented, this infection will be decreased in the numbers by reducing the use of antibiotics itself. Okay, these were the goals of antimicrobial stewardship. Thank you. Now the forum is open to ask the questions. How if anyone are willing to ask the question. For example, if it is not. Sorry.
No, yes, Dr. Hitendra. So I just want to hear your journey and what exactly this nodal officer part is, and how, what was your
Yes,
work,
sure,
what was your
sure,
job
sir.
profile there, and you get in.
Basically,
So that is the important part, what I want to share.
yes, sure. I was just giving a brief about what antimicrobial stewardship is. Okay, so now I'll go with the journey. That firstly, I have started I have completed my farm D. Okay, after that, I have started my journey as an assistant professor in Gitanjali Institute of Pharmacy, where I was supposed to take two, three subjects, which is pharmacotherapy 2, pharmacotherapy 3, and the biostatistics. After that, many a time what happens during the hospital rounds, during the students hospital rounds, they were bringing the cases to me, which showed that over there what happening is that number of irrational uses of antibiotics were going on. Prescribers were using antibiotics like a common medicine, a common drug, which we can say as an paracetamol. Uh, in every patient, I would say that there was a one antibiotics they were using. That is definitely sure. So what happens? What happened at that time? I used to go to the hospital with the students, and I was supposed to go and I tell the doctors that over here this particular antibiotic is not needed. This patient is not needed any antibiotics. Instead, we can go with the normal supportive therapy. No, we can go with the normal medicine, so that the patient will be better in that only, and the cost reduction will be happen like that way. So according to this, what there was an antimicrobial stewardship already a program which was running over there. One day, by that, they have called me for the antimicro for the after that they have appointed me as an assistant nodal officer for the antimicrobial stewardship. After that, I have made antibiogram. Antibiogram is the key component for which from which we can conclude that which antibiotic is susceptible to which particular bacteria. Okay, this is what my key role was over there, to make the antibiogram. From that antibiogram, we can make the antibiotic policy also. So this particular thing was this making of the antibiogram and making of the guideline for the hospital. As soon as I have completed the making of the antibiotic guidelines, I got an opportunity. uh, i I got an opportunity from AIIMS Jodhpur. I was just visiting to the sites, to the AIIMS Jodhpur, not just AIIMS Jodhpur, but all the research institute which gives the opportunity to the researchers, which gives the opportunity to all the students, to the aspiring students who are very well versed to get the knowledge, to get into the research, to do more and more research. I generally visit to to the sites, and at that time I have seen advertisement of this project, because and my colleague and one of my colleague has helped me to go into this opportunity. He has shown me the way, he has shown me the advertise. By this way I have gone through the interview in the AIIMS Jodhpur, and after that I got selected as an research associate 3 for the project, which is entitled as the implementation of antimicrobial stewardship in tertiary care hospital across India, in various tertiary care hospital across India. This was my whole journey throughout my 2.5 years of experience.
Perfect, perfect, wonderful, guys. So, anyone has any answer, any questions again, guys, to him? Otherwise, I'll take some questions from YouTube. Please tell me. Please tell Famdi can prescribe. You want to answer?
Uh, Actually, no, right now there is no such authority has been given to us. But yeah, we can give our reviews, we can give our reactions to the particular patient whose antibiotic is not who is the patient on which patient is on unappropriate antibiotics while rounds. We can give our reactions, we can write the note in the in that particular patient's file, that yeah, that we can do.
Yeah, so I hope you guys got it. And नोडल ऑफिसर गवर्नमेंट जॉब है या फार्मडी के लिए? दीपक चौधरी इज आस्किंग.
Not now, but as you have all, I don't know whether you have heard or not, but the president of the PCI, I don't know whether when it will going to be, but yeah, he has told that he is soon he'll going to get a government job for farm days as well.
Great. How to apply for research officer in AIIMS? That is the another question we have.
Research, for the research you have to go and visit to the site of the AIIMS, not just AIIMS Jodhpur, but as well as many of AIIMS are currently having this particular project as well. So just you have to visit the site of the AIIMS. You can visit the site of ICMR, you can visit the site of Manipal. Wherever the research has been carried out, you can visit over there and just check which project is been recruiting, and which project is good for you, good for farmd. Which profession is better, clinical pharmacy or clinical research? Sakshi has asked the question. It depends on you, it depends on your interest. Clinical pharmacy is also a very good profession, as well as clinical research is also a very good profession. Clinical, but both are completely different. Clinical pharmacy is something what you are dealing with the patient daily, you are dealing with the patient, and clinical research is something that you are doing research by which a patient can get better, by which healthcare can get much better. This is what difference between the clinical pharmacy and clinical research. So which is better? I would say whether you have to choose that you which is your core interest, to deal with the patient, or else to for the better reach, you would do more and more research in clinical background. PharmD can open clinic. No, sorry, you can't open the clinic. How to make antibiogram? Antibiogram is particularly the thing which you can make with the help of microbiology team, with the AST reports for the particular bacteria. You have to make a complete list, the trend of the bacteria, the trend of the resistant pattern, and the susceptible pattern of that particular antimicrobial antibiotic.
Someone from YouTube is asking if we can change the profession from clinical pharmacist to the.
Sorry, from clinical pharmacist to?
from clinical pharmacist to clinical research, how they can change that.
Yeah, you can change the
Deepak, we got your question. You don't have to copy paste it again and again. We got your question, Deepak. We will tell you, okay? Yes, please go ahead, Dr. Hitendrapal.
yeah, we can change our profession from clinical pharmacy to clinical research. But the thing is that if you are going in the clinical pharmacy, if you are staying over there in clinical pharmacy itself, then you will see that there is a complete the one thing, you will be so satisfied. Basically right now also, even though I am in a clinical research, even though I am in a research background, but what is going on with me that I am doing research as well, but I am also doing my clinical pharmacy role over in AIIMS. That is my personal, that is on my personal behalf, that I am doing because of my personal interest. Clinical pharmacy is the thing which you will take care of the patient, take care of the things which are going in wrong way, which are leading to the areas which are leading to any adverse events. Okay, so you can shift to from clinical pharmacy to the clinical research, but the thing is that you can't merge both things.
Yes.
You have to do it separately. Clinical research, you have to do it separately, and clinical pharmacy, that role is completely different. So don't jump from year to year. This is what my suggestion is. Yeah, you can do both, but while if you have joined the clinical pharmacy, then think over that can you, or you you have to do it or no. Then other then you, I would say, then you change your field, your profession.
Basic salary for nodal officer.
It
He has
depends.
asked multiple times.
Yeah, it depends on organizations. So there is not any particular range.
Can a B
The
Farm join ICMR? Yes,
sorry,
B
sorry,
Farms
sir.
also can join.
A small suggestion I would give, that if you are starting with if you're starting in any of the profession, I would say that just at the starting point, don't look at the your money perspective. First, you think that you have to learn something, and then you go for your money. Uh, that what the package will be there and all. Because if in starting only you will say that I should be taking this much amount from the company and all, then no, I what my personal experience says that no company will be like. So at starting point, just go for the learning, and after that you demand whatever your uh, thought is about that.
Yes. How your journey went from being assistant professor to research associate? Jitendra Kumar is asking.
Basically, so being genuine, being assistant professor, I have not enjoyed much because the particular students thinking, the basic student thinking, what I would say is being genuine, that I was in hurry, that my family is getting over and I am not getting jobs yet. I have not get any sort of job. So at that time, whichever job I got, I took, and then I got an opportunity. I just waited over there for a year, and I got the other opportunity as in research associate. So I took, and currently I am enjoying my job. I am loving being over here.
That's nice. That's nice. Yes,
Being
B Farm
genuine,
can B Farm
every
can.
student thinks that when we'll get the job, when we'll get paid after completing our graduation.
Ashay Gupta is asking, sir, can we make an antibiogram for any of the hospitals by starting stewardship programs?
No, not like that. It might depend on the depend on the hospitals, that who is supposed to do that work. Not every hospital says the research associate or the nodal officer, assistant nodal officer to make the antibiogram. Many of the time,
Oh,
antimicrobiome are is being made by microbiology team itself.
yes. Any extra courses to improve my CV? Okay, so you can just visit our website. It is
You can go through the site that is claimed. You can get many of the courses over here.
and I have shared our new institute website also. They can go for with the curio also. Infection T control team develops antiviral and give us protocol how to develop it. Definitely. Any more questions? Let me see in the YouTube. Sir, you told that implementation of antimicrobial stewardship reduced irrationality. And what does antibiogram does in every hospital which are used? He is asking the question, Akshay.
So can you please repeat the question?
Sir, you told that implementation of antimicrobial stewardship reduces the irrationality of the antibiotics. Okay. Then
Yeah.
what does antibiogram does in every hospital?
Okay, antibiogram helps the steward to go through the resistant pattern of that particular microbe. So from which we can avoid the use of the drug which is already resist to that particular microbe or bacteria. From that we can we can reduce the irrational use of antibiotics.
Great. Okay, sir, I am the fifth year right now and doing AMS as part of my clerkship. What are basic skills does a PharmD student need to learn before graduating? Nana is asking.
Just to start learning how to look patient clinically. Okay, you are in the fifth year PharmD, so I am sure that you must be knowing you are well versed with the theoretical part of of the uses of antibiotics, but as well as you start learning to look out the patient clinically, see whether the patient is febrile, see whether the count of the patients are normal or not, the respiratory rate, the ventilator parameters of the particular patient. Go through it, go through the file completely. You should know the patient in and out. After that, only you can uh, say that you go with this antibiotics or you have to select that antibiotic. Not directly you can challenge the decision of doctors. So I would say learn the patient to look clinically as well.
Okay. I'm currently third year of BPharm and in future I want to do projects and research related to AMS and AMR because I am much interested in this. So how to start and can I do this after BPharm?
Yeah, definitely you can also do it after the B Farm. You can go through the various CROs, that is clinical research organization, for the jobs as well. I don't think that many of the organization must be having this antimicrobial stewardship, but yeah, in B Farm fourth year, you can carry out your project in this particular topic also.
Yes, wonderful. So we got all the questions from YouTube. Okay, now is there any question in Zoom link, guys? I hope everyone here got the feedback link. I will not share it later. Okay. फार्मडी के लिए एम्स में परमानेंट जॉब है या कॉन्ट्रैक्ट बेसिस पे
Not
दीपक
yet,
विलास?
not yet. But soon there is a talk going on that they will be making a permanent department for the antimicrobial stewardship.
Yes, and guys, I'm working as scientist C for ICMR. This my post is also not permanent. Okay, I'm just hired for 3 years. My 3 years are going to end. I may get extension, but it is not for sure. Okay, all
Any
the only the technical jobs are permanent. If you are joining as CRC or CRA or any kind of RA research associate 1, 2, 3 or scientist, those jobs in ICMR are not permanent. Those are on contract basis. Okay, all even to the scientist D, scientist C, scientist F. Not the scientist F. Scientist F is the director level. but before that any. Okay, D, E, C, B, A, B, and all three RAs are not the permanent jobs in ICMR. They take it only on contract basis per project. Okay.
Yes. Any of the research associate or any of the that you think that they are giving on the advertisement basis, they are not permanent, they are contractual basis only. Just the faculties over here in AIIMS, they are on permanent, as well as the nursing staff, they are permanent. No one else over here, they are permanent. They all of
Yes.
them are on contract basis.
Subham, the way how I apply in ICMR, please go to ICMR website. There is an option careers and opportunities. Please search, and there are multiple opportunities in that. Okay. Okay, guys. So, any other question? Sir, does every doctor follows the antibiogram that is formed by the family profession and microbiology team? Because the doctors, they underestimate the family students only knows how to find the mistakes like Edward Spent. So I would like you to answer this question, Hitendrapal.
Yeah, I would say this is a biggest challenge. I would say that you have to face during your, not just in as a research associate, but also as a clinical pharmacologist, because the knowledge the doctor has, you can't challenge it directly without the evidence. You can't challenge it. So ever if you are going to do this, go with the proof, go with the evidence that sir, see, this is the evidence in my hand. So you have made a mistake over here, you have to change. Not like that you go and directly fire on the doctor, likely, but being very polite, you have to request to the doctor, and as sir, please, this whatever so and so drug you have been prescribed is not appropriate for that particular patient. So kindly change, switch the antibiotics or change the antibiotic dose or regimen, whatever you have to do with that patient is like that way. Yeah, but that is the biggest challenge you will face.
Yes, absolutely, absolutely. Yes, guys. Yes, guys. Okay, which slides you are asking, Regala Vishnu Kumar? Which slides you are asking? Slides of yesterday topic? Please write which topic yesterday. Except ICH guidelines, we don't know what we were. And ICH guidelines, we don't share the slides. We are sharing the recordings because those slides are from the people who are taking the classes, and those are there is a conflict of interest, right? So we cannot share the slides of that, but we are sharing the recordings for your references. Qualification marks for ICMR is different. It's various. There are many qualifications for different posts. Like you can join after B Farm or PharmD, you can join the technical post, you can join the research associate. Even I think PharmDs can join the research scientist C along with PhD if they have the PhD also. Okay. Research scientist also they can join. So different things are there. Just go and check the ICMR website. You will get all the things there. You will get all the things there. Okay. What should I have do after B Farm or M Farm or PharmD, which is better? What should I do, sir, after B Farm, M Farm or PharmD? This is totally your interest. If you want to work in the hospital, go for PharmD. If you want to work in the industry, go for M Farm. Or you can start by B Farm also. This is totally up to you. If you want to go for higher education, you want to go for industry, you want to go for hospital work. So choose your path wisely. Okay, choose your path wisely. If you want to do B Farm or PharmD postbac, see, you can see PharmD postbacs also. There are people, Hitendra is there, I'm there. Many people are there, right, who are doing wonders. So it is just you. You have to choose the right path, and what you want to do, just select that, and based on that, you choose your path. Okay. Right, guys? Can you please share the reference for studying the ABX clinical prescription methods and specific disease for ABX wills? I don't know. How to start clinical research after B Pharm? So, okay, that's a tough question because B Farm usually we do not the clinical research. Either you can go to the Farm D, you can join the M Farm pharmacy practice, or you can work as a clinical research coordinator in any project if you want to. Okay, that is the right way. Or nowadays UGC has allowed the PhDs also after B Farm, but you have to do B Farm with 75% of the marks, and there are some other eligibilities. You have to clear those eligibilities. You can go for PhD also, and then you can start your clinical research. There are multiple ways, but immediately after PharmD, you cannot go into the. I mean, during the PharmD, you cannot be Pharm. You cannot go into the research, but after that, you can just join the clinical research in any hospital as a CRC. B Farms are also allowed in multiple things as a research pharmacist, clinical research pharmacist. There are the posts especially. So B Farm and PharmD, anyone can join those posts, and then you can enter into the clinical research. Okay.
Yes, I'll just add one thing also in this question that after BPharm you can also go for the courses which are included into the clinical research. So by doing that course also you can go into the clinical research field. Many of courses are available which are online, and many of the consultancy also do that particular courses. So you can visit over there.
Yes, so okay, yes, definitely you can just add on some value to your CV by doing 3 months, 4 months, or 6 months course in clinical research, and then you can go to the clinical research industry. That's perfectly fine. He's perfectly right here. Which one is better, PhD or PharmD? See, you must be eligible first for the PhD, then you think about the PhD. Okay, you can think of PharmD or MPharm pharmacy practice in the higher education. You can go for MSc, pharmacogenomics, pharmacoeconomics. You can go for MPH after BPharm. There are a lot of things. Why you are just thinking of PharmD or MPharm? There is MPS, there is MSc, there is MS, there is multiple things. Okay, pharmacoeconomics, pharmacogenomics. There are a lot of areas. Many pharmacometrics. There are many areas where you can explore after BPharm. Okay, lot of areas. And tomorrow I'm again coming up with one more wonderful webinar, guys. Yes. Any other questions, guys, or shall we wind up? And remember this: I'm not going to share the feedback form with anyone after this. Okay, this is the last time I'm sharing this. Okay, let me check if any question from YouTube. Sir, I'm first year PharmD, want to start review writing. Please give me some suggestions. Om, tomorrow you come tomorrow. I have the webinar on that only publication. I'll share the link. Okay. For applying drug inspector, is it compulsory needed internship in industry as PharmD? I have no idea, dear. I have no idea about this. I'll just check into this, and then I'll let you know. I have no idea of this. Okay, if Dr. Hitendra can give some idea on that, I have literally no idea.
Like for drug inspector,
Yes, 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 yes.
what I know that you have to do you have to take the experience from industries only for up to 18 months or 2 years. What I know, according to my knowledge, yeah, you have to do that.
Yes, 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 absolutely, absolutely. So guys, please fill the form, and thank you very much for this for joining this wonderful webinar, guys. And thank you, Hitendra, for
Thank,
delivering this session, guys. Thank you. Good
thank you,
night.
sir.
And thank you very much. Thank you, Bharat, for coordinating very well to conduct this webinar, the Dr. RX. So thank you very much, guys. Take care, and fill the feedback form. Okay, guys, take care. Please take care.
Thanks to you, sir.
Thank you, Dr. Hitendra. Thank you for this wonderful session.